Lisa with justorthopedic.com, back with Dr. Nilpesh Patel with Lakewood Orthopedics and Sports Medicine. So what is the difference between open and minimally invasive or endoscopic carpal tunnel release?
So carpal tunnel syndrome is caused by compression of the median nerve at the wrist. This is a nerve that comes down from the top of the arm, goes down the arm, and into the hand. It gives feeling into your fingers and gives you function, especially in thumb use. That nerve can have pressure in it at the wrist level. There's a tunnel that it goes through, and this tunnel is made up of bones and a ligament that covers that tunnel. And inside of that tunnel, you get increased pressure, which then causes nerve symptoms such as numbness, tingling, pain, weakness. So there are multiple methods of treating this, both conservatively and with surgery. We usually start by treating conservatively by changing your activities, using braces, sometimes taking anti-inflammatories. Then when we start talking about surgery, we start talking about releasing the carpal tunnel. And what that literally means is opening that tunnel up to decrease the pressure so that the nerves can recover and repair themselves so that you can get improvement in your symptoms. Traditionally, they have done it in an open fashion. And this means an incision that usually goes along the palm and close to the wrist. You go through the skin and you open up that tunnel. Okay. Nowadays, there's also minimally invasive or endoscopic carpal tunnel release. The difference is that the incision usually for this type of procedure is not in the palm and more at the wrist level. When I perform an endoscopic carpal tunnel release, I do it through one incision at the wrist level. Then I insert a camera with a knife blade that is attached to it into the carpal tunnel, and from looking inside the carpal tunnel, you can cut the ligament. The incision is smaller. The incision also is not in the palm, which patients like. There is slightly faster recovery after having an endoscopic carpal tunnel and good results at the end that are very equal, that are just as equal to open carpal tunnel release. I think the key is that you have your condition diagnosed appropriately, that you try your conservative management, and then you think about all of your surgical options and know the different options when picking which surgery to do. I prefer the endoscopic carpal tunnel release. I feel that I'm most comfortable doing that, and I think patients do great after it.
Again, some more great information from Dr. Nilpesh Patel, Lakewood Orthopedics and Sports Medicine. Thanks again for being with us today.
Thank you.